We go now to our reporter Laura Windsor to find out about genomic cancer research.
Nearly 900 medicines are in development for cancer treatments. Identifying the specific one that works on a child's disease is the challenge, explains Dr. Leonard Sender, the medical director of Hyundai Cancer Institute at Children's Hospital of Orange County. We asked Dr. Sender to explain genomic cancer research.
In 1948, Sidney Farber was the first oncologist to start giving chemotherapy to a child. And it was a child with acute leukemia. And in those days, those children would live about 6 weeks. Today, if you're under the age of 10 and diagnosed with cancer, you've got a 90% chance of making it to 5 years and about an 88% chance of making it to 10 and 20 years. So we've changed dramatically. The sad part is that we sometimes use the same drugs as we did in 1948. It's time to re-look at how we treat cancer. We now have the tools. It's 10 years since the human genome was sequenced. So every one of us have cells. Inside the cell there's something called a nucleus. Inside the nucleus is DNA. It controls the blueprint of who we are, what each cell does, how cells work. That has now been sequenced. It turns out it has 3 billion base pairs, and A, G, T, C. Those 3 billion give the code. The new cancer doctor of the future is going to be someone who's going to look at the genome. That term given to describe what that genetics is about of the tumor. We're going to look at that tumor genetics. We're going to compare it to the person's normal. So you were born with a certain DNA code. If you think about cancer, cancer is an evolution of your normal into something bad. That cancer cell somehow made a change. And when we say the cancer exists, it's because it happened at the genetic level. There was a change that occurred. We're going to analyze that. We're going to look at that. And for the first time ever, we're going to really put great science to use to really come up with science-directed medicine rather than what we call evidence-based medicines. What I personally am involved with in the Hyundai Cancer Institute is this human genome project where we're looking at kids whose cancers come back, kids whose cancer has not responded to upfront therapy. We are taking their tumor, we are isolating the DNA and RNA. My lab is working with the best scientists in the world. We're dissecting that, we're sequencing it, we're analyzing it, and then we're going to hope to bring that back to the patient so we can say, we have found potentially the Achilles heel of your tumor so we can find the right medicine for the right patient. We are involved with clinical trials. In fact, we have 141 open clinical trials, meaning we believe that research is fundamental and core. It's the core of what we are. We will not cure cancer in these children unless we do research. What we're doing here is a mixture at our CHOC Hyundai Cancer Institute, a mixture of the best of classical oncology, the best of traditional oncology, the most up-to-date research studies, the most up-to-date new drugs, sometimes just new ways of giving those drugs in combinations. At the same time, we're going to try and be in this new world and trying to put that. And our goal is to bring the two together. It is my belief that when I'm interviewed 5 years from now, that absolutely would have happened. And we're going to start on an amazing discovery journey that I think is going to yield better treatments, more targeted treatments, and a better way to treat these young children.
This groundbreaking cancer research using the latest advances in genomic medicine will provide more effective, individualized treatment for children afflicted with this disease. For the American Health Journal, I'm Laura Windsor.